Welcome all. Thank you for joining um, my webinar here. My name is Jadivan Jacobson, and today I'm here to help a little bit in understanding healthcare plans because sometimes it gets very confusing for us when we want to choose or purchase a health care plan. So when we are trying to evaluate health plans, it's essential to pay attention to specific keywords and concepts to ensure you understand the coverage and make informed decisions in purchasing or selecting a health plan. So here are some of the words that we're going to go through today. And let's start with that. The reason I also want to share about this because I believe that healthcare should be available for everyone, and healthcare can be very confusing. And they use some terms that are not friendly to us or easy to understand. I remember when I came to the US and I started um, having, health issues. I went to the doctor, and then when I got back home a few weeks later, I got a letter in the mail, and it says $200 that I owe them. And it was very outrageous for me. I was like, I have an insurance. I don't understand how they are not covering anything. And it was like 100% that I had to pay. And I had no idea about what is deductible at that time. So I did not meet my deductible at the time, and therefore I had to pay the $200 in there. So to avoid such a stress, it would be great to increase the sense of assurance. So let's learn a little bit more. So the word premium is basically your monthly fee that you pay to the insurance just to have health insurance. So it's your membership. It's and the number for that could be different from one health plan to another. I'm going to give an example toward the end as well about this. So something like to be considerate like consideration about premiums when you're selecting. Sometimes affordable premiums are essential, but make sure that the plan get what the your needs are, right? So it covers your needs. If you have specific needs, you get to check what services they cover, what services they do not cover, as well how many and how often do they cover that. Now, the deductible. So often healthcare plans would have an amount of money that even though you have paid your premium, you have to pay that first before they start paying or for them to start having the copay or co-insurance. And it is different from one plan to another. And it's also the amount is different from individual to family plans. So higher deductibles often result in lower premiums, but may mean higher out-of-pocket cost when you need medical care. So for example, if my premium, I'm just gonna quick, like if my premium is $100, but my deductible is 2,500, if I go to a doctor appointment and the first appointment was $250, I'll be paying $250 out of pocket, and insurance would not be paying anything until I meet the $2,500. Some healthcare plans do not have that. They have like zero or very lower. So checking on that is very important. Um, so here we have the copay versus the co-insurance. So the copay, it means that, or the definition of it is the fixed amount you will pay every time you have a service. And so consideration, check copay amounts for common services and prescriptions. And there are sometimes for other services. So make sure how much is your copay that you will pay. Sometimes it's for generic drugs is different than other drugs. Um, PCP visit is different than dental visit, than specialist in network versus out of network. So make sure that you understand what is your copay. So every time, no matter what is it, if that's your plan, um, check about what is your copay. Now, the co-insurance is a percentage. So it's a percentage of the cost. So after you meet your deductible, and this is usually after deductibles, you will be sharing a cost. So the insurance will be paying, for example, 80%, and you'll pay 20% of that visit, of that medication. Be aware of the percentage as well in here. Some is different from in-network versus out-of-network, um, and from visits to visits. Some services as well are different. So PCP, for example, might be you pay only 10% versus a specialist, you pay 40%. And that's also special for dental work. Some services are, they cover, like, let's say 100%, they cover 80%, 60%, and 40%. So making sure to understand that. The out-of-pocket maximum limit. So this is the like as we pay for example like from out of for coverage every time we go. This is not including the premium at all. So this would be toward the deductible and out of pocket. And the insurance would say like after you meet this limit, we will pay 100%. So deductible is they don't pay at all until you meet the deductible, right? So you pay 100%, and then after that, when you meet the deductible, you start paying, let's say, 20%. The accumulation of all those 20% plus the deductible, if it reached the max out of pocket, after that, if you go to the doctor, they will be covering 100%. Some out of pockets are very high, like $7,000, $12,000, 17, and I've seen even $22,000. So understanding what is your out of pocket could also help you to potentially maximize your financial exposure, when to do a surgery, when not to. If you meet your deductible and meet out of pocket, be like, well, I need a surgery now. So that might be really helpful to understand. So there's in-network and there's out-of-network. So this is the facilities providers and suppliers for your health insurance, has contracts to provide healthcare services. So sometimes because they are contracted with them, your services might be cheaper there than in other place. So check if your health insurance have a preferred providers that is in network to avoid higher costs, like the same service that you would get from an in-network doctor might be cheaper than one that is out of network, which is usually higher because they're not contracted. And now we have um, coverage limits and there's exclusions. So coverage limit, it would be services that are included in your health insurance, but they might be limited to how many services they would provide or how much they would be paying for that. So be aware of those limitations. So for example, most of healthcare insurances would say you get only 12 PT, physical therapy sessions, or only 5 massage therapy. right? So if that's what is included, making sure. We know that for dental as well, like you have two cleaning per year, and they would say you have to have about 6 months in between each visit. So if you wanted to clean your teeth more, you would probably pay out of pocket fully for that. The exclusion is services that um, treatments are not covered at all by your healthcare plan. So here is understanding if there is some treatments that you need and your health care does not cover it at all, then this might be not the best healthcare plan, or you might want to advocate and call and a doctor to advocate with you to get those covered. Most of the times, they're very, very on point and they do not cover those things. Um, so, for example, like most of healthcare do not cover at all. They don't cover at all the hearing aids, right? They might say, "We'll do the hearing test, but we would not cover any part for the hearing aids." Um, and another thing to be aware of regarding exclusions. So if they do not cover it and you're paying fully out of pocket, check if your insurance would still consider it toward out of pocket um, uh, amount or total, right? So let's say you went and bought hearing aid for $3,000. Would that be counted toward the deductibles and the out of pocket? So this way it helps you as well. Now, the last part here, or one of the parts here, is about preventative services. So we talked about some that you would have to pay deductibles sometimes and the out of pocket. Now, there are some services that the insurance would start covering immediately. So this is some routine healthcare checks that includes screening, vaccines, and some counseling to prevent illness and disease. You want to actually check with your health insurance what are those services that are covered by um, by your health care and consider it as preventative. When you are wanting to do those preventative services, you have to actually ask for them before you even schedule them. So when you're calling to schedule, for example, your primary visit, the annual visit with your primary care provider, you would have to call and say, "This is going to be my annual visit," which each person would get about once a year. Um, Now, if you do not do that, it would be considered just a doctor visit and you'll have to pay it before even deductibles, right? It'd be like surprised. Another thing to consider is that even though this would be preventative visit, let's say, and you're scheduled correctly, if during the visit there is any issue that you brought up and said, "I want a diagnosis for this," it shifts that portion to becoming diagnostic, and therefore they will bill for it, and you would have to pay for that portion. So ask your doctor before if they're going to be like, this is going to be diagnostic. You could decline services. You could say, "Nope, I'm here just for today for the preventative. I don't want diagnostic." Although that might be very health calling on your own health as well. Okay. So, now about prescriptions and drugs, details here about how the plan covers medication. So understanding how much the how much your insurance covers for each medication, and sometimes generic and non-generic are different as well. the same way that copays versus coinsurance. Um, oh, you might want to even check sometimes the prices are different. Therefore, you might say to the pharmacist, could you check which one is cheaper for me? Now, if there's any deny for your claim, you might want to do an appeal. And this is where you understand a little bit more about how to appeal for your insurance, how to fight them back. Sometimes your PCP or doctor or provider would be able to as well submit an appeal on your behalf. Those appeals do not have to happen after the services. They could also happen before. So let's say there is a prevent limitation, right? And that's where you and your doctor, for example, would be fighting the insurance, applying for appeals before, so pre-approval for the insurance to pay or co-pay with that or co-insurance. Um, Make sure here basically to understand your the process and where and how you do that. Document every single thing. Even if you do a phone call, document that. If you're able to send that as a documentation to them as well, like the summary, that would be great too. Now some insurances as well, you would have a benefit called HSA or FSA. There are two different. So HSA is a health saving account and FSA is flexible spending account. So those both of those are pre-tax. So pre-tax money that we'll put on a card that you could use only for medical things and medical related. Medical related could be including, for example, like a cane or device. You could check the list as well on their websites for what they cover, what they consider okay, and what is not considered okay to spend. Now, there are differences between the two, and you might be eligible for one but not the other. Depends on the health care plan that you choose. So usually the high deductible one does get the HSA but not FSA. The low deductible one, which is usually the one that has copays, is the one with FSA in there. Now, the HSA is a type of saving account that paired with a high deductible, as we said. Now, for you, the ownership of it, this is you control it. You contribute to it. Your employee could contribute to it if you're working as well. But you could keep that money as well. So the contribution limit into 2024 for individual is $4,150, and then for family is $8,300. And there's additional thousand for people who are 55 and older. Um, After 1 year, you could continue keeping that money after the end of the year, I mean, and you could use it again and again. You could use it throughout your life. Now, the FSA is a benefit that offered by employers, allowing also employees to set aside the pre-tax dollars for eligible medical expenses. Now, the FSA is employer owned. So if you change one employer or job to another, you may lose actually that fund. Another thing is that by the end of the year, if you did not spend that money, it would not be carry over and you would lose that money. So if you contributed, let's say $400 and you did not use them, you lose them. And it would not be, there's no way for you to get that back. And there's a limit for that, how much you could contribute. It's 3,200 for individual. Um, and or I think that's actually for both. Now, another thing to look at is what are some tax benefits for it. So some tax benefits for the HSA is that it is tax deductible, so it reduces the taxable amount, the income in there. Earnings and interest on that are tax free. If you withdraw, for like basically spend money from that, like use it, you would use it for medical expenses that are tax free. And as we said, roll over, you could use that amount throughout your life. And I believe as well that if, let's say, you die, someone else could take over that money. So it would not be lost. Um, I like my HSA. I use it all the time as well. Now for the FSA, the contributions are made also pre-tax dollars, which reduces the income, and withdrawals would be also for the medical expenses. But the not beneficial grade there that use it or lose it. So you use the money or lose the money in there. Um, yeah. So that's about the FSA and HSA. So in summary of today's presentation in here is understanding the keywords um, will empower you to make informed decisions about your healthcare coverage, and always be careful. Review very, very carefully any plan and contacts for the insurance. You might ask for all those even before you sign up. It's okay. Well, and then for choosing those health insurances, there's I'm only saying recommending this website, not to say like it's the best. It's not. It's not. Definitely it's not. But it might help you seeing if you qualify for the state health insurance. For other health insurances, like let's say you do not qualify, I would recommend that you do your research with each care plan by itself. Sometimes the ones on there are very, very expensive, or um, they are not the greatest options. So do your research, put your incomes in there, figuring out who's going to be covered, who's not going to be covered in that health insurance. Is it individual versus family? Usually family is very expensive unless basically it's covering several people. Now I'm going to give here some examples for those health plans, and those are actual numbers. So one plan, the premium is 190 for that's for pretty much kind of like an estimate for an individual. So if it's a family, usually there's a lot like another 50 to $80 more and maybe more. So the deductible for that plan, individual is 6,000, for the family is 12,000, which is outrageous. Like you get to pay $6,000 before the insurance even covers anything, right? It's like if I'm a healthy person, would would that be kind of like easy or not for me? Um, Now for this one has a copay. The copay for each doctor visit is $50 and $32 for generic drugs. You might again check for in-network versus out-of-network. This is the one that is in-network. And the out-of-pocket max is 9,200, and then for the family, 18,400. Now, second plan is higher. You see, it's a little bit higher premium there. 730. The deductible is 2,500 per individual and 5,000 for a family. And now this one has the co-insurance. So after the deductible is met, the in-network, the person will be paying 10 to 30%. Um, and the insurance will be paying 90 to 70%. It depends on the service, and then for the out of network, it's 40% that the person will be paying. And then the out of pocket, it's different for this one for in network versus out of network. So here you want to make sure that if you're going to a doctor, that if you want to meet the max of the, the out of pocket max for the in network, to only see doctors in network, and that's 5,500 versus for family 11,000, and for the out of network 11,000 for versus for family 22,000. You can see for the third one is a little bit different. It is a high premium, but the deductible is much lower. So for medical, immediately, there's no deductible. It's zero. You start your copays and taking, your prescription. Um, but they have prescription drugs deductible. So when you go to the doctor, they immediately start paying. You only pay $20 for the doctor, and they pay for the rest of the medical. But if you have a prescription, you have to pay the first $1,500 for as an individual versus $3,000 for a family, and then they start paying. And I think that's even beside the $30 that you'll be paying. So like you paid $30 for the generic drug, uh, plus the cost of the medication, which could be like very expensive. The out-of-pocket max, and you see the numbers in there, and the last one is 4,025 as premium, and then deductible is 500 for individual, which is considerably low, and the copay is $10 for PCP and $3 for generic drugs, which I would assume that would be kind of like something good. Now, something to consider that I actually did not put a slide for that is the total cost for you. So the way that you do the total cost is taking the premium as estimate number, multiply that by 12, right? And you start saying, how many times I'm assuming that I'm going to need to go to the doctor, or is there a prescription that I take? And that's where you could start kind of like calculating to figure out how much out of pocket you're going to max or use throughout the year, and which of those would be more beneficial for you. This is the presentation for today in the webinar. I'm happy to answer any of your questions as well. Again, my name is Jadivan Jacobson, and feel free to visit my website, Clarity with Jadivan. The website itself is jadivan.com.